The opioid crisis has driven a desperate search for safer pain management alternatives, with buprenorphine emerging as a potential option. Buprenorphine is a partial opioid agonist believed to provide pain relief with a lower risk of dependence and overdose compared to opioids like oxycodone or fentanyl. However, recent findings paint a less optimistic picture. A study evaluating buprenorphine as an alternative to traditional opioids reveals a concerning reality. It did not significantly improve pain management or reduce opioid use. These results raise doubts about buprenorphine's potential to solve the opioid crisis, revealing gaps in pain treatment strategies and the limitations of current harm reduction approaches. One troubling aspect is that it contradicts the growing belief that buprenorphine is a game changer for pain patients. While buprenorphine has been successful in opioid use disorder treatment, its role in chronic pain management is less clear. The assumption that switching patients to buprenorphine would lead to better pain control and less opioid dependency now seems flawed. If patients don't experience pain relief, they may remain on stronger opioids or seek alternatives, including illicit substances. This raises concerns about whether medical professionals are overestimating buprenorphine's efficacy in pain treatment. Another alarming implication is the lack of truly effective, non-addictive pain relief options. Chronic pain is complex and debilitating, leaving patients trapped between opioid addiction and inadequate alternatives. The failure of buprenorphine to reduce opioid dependence suggests it may not address the root causes of pain for many patients. This leaves millions still relying on high-dose opioids, exposing them to risks like overdose, tolerance buildup, and long-term health complications. It also reinforces the growing frustration among chronic pain patients who feel abandoned by a healthcare system offering limited or addictive medications. These findings also raise concerns about whether the push for buprenorphine is diverting attention from other promising pain management research. If the medical community focuses on buprenorphine as the best alternative, it could delay investment in non-opioid treatments like nerve stimulation or cannabinoid-based therapies. This misplaced focus could prevent the development of innovative solutions that offer relief without addiction risks. The failure of buprenorphine should be a wake-up call to policymakers and healthcare providers about the urgent need for long-term, comprehensive strategies. There's also the risk that reliance on buprenorphine could create new, unintended consequences. If patients feel their pain isn't managed effectively, they may turn to illicit sources for stronger relief, fueling the fentanyl epidemic. Promoting buprenorphine as a safer opioid could lull healthcare providers into a false sense of security, potentially leading to overprescription. The failure of buprenorphine highlights the need for a science-driven approach to pain management. Patients deserve better than being shuffled from one opioid to another without real progress in alleviating their suffering. We need to prioritize developing alternative treatments that go beyond opioids. Harm reduction is important, but it can't replace the fundamental need for more effective, safer pain relief options. The opioid crisis remains dire, and patients with chronic pain continue to face limited, inadequate choices. Chronic pain patients have been failed by a healthcare system that too often overlooks their complex needs. The opioid epidemic began with overprescription, and now we face a shortage of truly effective treatments. The solution to the opioid crisis cannot lie in substituting one opioid for another. We must rethink our approach to pain management and addiction. It's time to focus on comprehensive solutions that provide long-term relief without the risk of addiction. Innovative, non-opioid treatments must be developed and made accessible. The current approach isn't working, and more lives are at stake every day. The reality is that the opioid crisis cannot be solved with quick fixes or surface-level solutions. We need a deeper, more thoughtful approach, one that takes into account the full scope of chronic pain and addiction. The failure of buprenorphine as a pain management solution should serve as a clear signal to policymakers, doctors, and patients alike. We need to do more. We must push for research, funding, and policies that prioritize non-addictive, effective pain relief. Without these changes, millions will continue to suffer, and the opioid epidemic will continue to claim lives. The time for meaningful change is now, before it's too late.